Okay, so we will be having a look at a case note. Then, of course, we will go through the case note, select relevant information, reject irrelevant information. Then we will be we'll discuss the organizing. We'll do the intro. We'll organize the introductory paragraph. Then we'll discuss the organization of the whole letter. Then finally, we will analyze the sample letter. Okay, so this is exactly what we are going to do today. So let's start. Here we go. Okay, all right. Let's start with the case note. Get ready. Right. Okay. So I want all of you to take a second. Read the first paragraph. Okay. Read the first paragraph. All of you. Okay. So Smita, what is your role as a writer here? Who are you as a writer?
Community nurse, ma'am.
So yes, you are a community nurse working for Blue Care. Okay. Okay, so they have not given your name, but they have given your job and where you work. So in this letter, you are, as a writer, you are a community nurse. Okay, all right. Now let's have a look at the writing task. Take a second. Yeah, take 30 seconds. Go through the writing task. Okay. Smita, who are you writing the letter to?
Letter to the director, Redeemer
Palliative Care
Hospital.
Okay. So have they given the type of letter here? Have they given what type? No, they have not given the type, but we know our reader is a director of Palliative Care Hospital. And what exactly is our purpose? What do we want from the reader? What do you want the reader to do for the patient?
To provide palliative care.
Palliate respite admission. Palliative respite admissions. Always remember, respite admission means temporary, something for some time. Okay, not for long, for some time. So, as part of palliative care, you want your reader to provide palliative respite admission for your patient. Okay, so we don't know what type of letter it is. So if you're planning to start your intro with I am writing to, then it is good to know the type. So later on, when we read the case note, you need to understand what type of letter it is. Okay, but if you're starting your letter with thank you or with a patient's name, then you don't need to worry about that. Okay, so we know our role is that of a community nurse, and we are writing to the director of a palliative care hospital, and we want the director to provide them to provide palliative respite admission for our patient. Okay, so now let's read the case note. Okay, so get ready. Okay, read the case note. Okay, all right. So I want all of you to one second. Let me just arrange the screen well so you can see. Okay, so go through the patient's name, next of kin, and medical history. All of you. All of you. Make a note of the dates. One second, before you do that, take a second, go through today's date. So today's date is the day you're writing the letter is on 6th March 2019. Make a note of that. Okay, now read till the medical history. Carefully read, go through it. Don't worry about selecting the information, just read and understand. Make sure to make a note of the date so you're not confused. Today's date is March 6th. Okay. Go through the discharge date as well. Okay. Now go through her current medications. Okay. Go through social history and plan. So there is an error here. Let me correct that. Here it should be Mrs. Williams. Okay. All right. So I hope all of you have read the case note. So now tell me, what type of letter do you think it is? Does the reader know the patient? Does the reader know the patient? Smita, what do you think? Jose, what do you think? Preeta, what do you think? Does the reader know the patient?
No.
No. Okay. And you are sending the patient. So right now the patient is at their home, and now you're sending the patient to a palliative care hospital, and we want them to provide palliative respite admission. So what type of letter can this be? Is it a referral letter? Is it a discharge letter? Is it a transfer letter?
Referral letter.
Referral letter. Referral letter, correct. Referral letter. You're introducing a patient to a person who does not know the patient, and okay, you will be like, ma'am, but they're moving to a center. Yes, they are, but no, if they're moving from their home, not from facility to facility. If it's a facility to facility, only then we can consider it as a transfer letter. Otherwise, this is a referral letter. You're introducing your patient to a person who does not know the patient. So you're writing a referral letter. So this is a referral letter. Okay. All right. So we know, we have understood the case note. Okay. We know what the purpose is. We know the reader does not know the patient. Now let's select relevant details. Okay. All right. And remember, we will reject the details that's not going to affect what the reader is going to do for the patient. Okay. So of course, today's date is important. Our role is important. Okay. Now, name of the patient, of course, date of birth. Should I say married? Is it important that I inform the reader that the patient is married?
No,
No
ma'am.
need.
No. Okay. What about the children? How many kids she has?
No.
Is it
No.
okay? All right, but
Not required.
not required. But we do we talk? Will we be talking about the kids later? Okay, let's put that on hold. Let's put that on hold. Okay, so I don't need to mention married. That's correct. So should I talk about her job before she fell sick?
No need.
No, no need, no need. Okay, and what about her husband?
No, ma'am.
No need.
Why not? Why not? Yes, we need, because he is the reason that we are sending the patient to this person's facility, right? So we need to write the husband. We don't need to write the husband's job, but you need to write the husband's name, because husband is one of the reasons, because husband is not able to take care of her anymore. He is struggling. That is the reason we are referring this patient to this particular reader. So of course, you need to include the husband's name. Okay. Now, what about tonsillectomy? Should I include that? And appendectomy? Should I include tonsillectomy and appendectomy?
No need.
No
Good,
need.
ma'am.
So, okay. And what about laparoscopy? Should I tell the reader that the patient underwent a laparoscopy that which revealed that? Should I say that? Is laparoscopy important at this stage?
A stage 4 ovarian cancer diagnosis.
Diagnosis is important. Of course, I need to put stage 4 ovarian cancer, but laparoscopy and the date of diagnosis, is it important? Not
No,
exact, no. But if you want, you can mention the month. It was diagnosed in last December. Okay. And now, should I say the patient was admitted with abdominal pain? Is that important?
No need.
Yes.
No need. Why? Why does it matter to the reader now? The reader knows, listen to me carefully, the reader knows the patient has ovarian cancer. Diagnosis is important.
Diagnose the condition.
Yeah, but you don't need to write the symptom that led to it. You don't need to write that. You don't need to write laparoscopy. You don't need to write tonsillectomy. All those things are not required. Okay. All right. Now, what about the metastasis? Should I include that? Yes, I can write that. Okay. And that brings me to something. What is negative prognosis? What does that mean? What is the meaning of prognosis? Yeah.
Deterioration of the condition, no improvement in her condition.
Smita, your voice is breaking. Can you repeat that once again? Yes.
Yes, ma'am. In her condition, no improvement, only deterioration is there.
Okay, so but what is the that is correct, but that is the meaning of negative prognosis. What do we understand by prognosis? When we say prognosis, what is the meaning of that?
Chances for survival.
Not exactly. Not exactly. Okay, progress. Okay. Okay, no, okay. When someone talks about in reading or in speaking as well as in writing, when they mention prognosis, prognosis is how the condition is going to affect someone's life in long term. So, for example, in asthma, when it comes to the prognosis, the asthma prognosis could be the patient will need to use an inhaler lifelong, and patient can expect frequent asthma attacks. So that is the prognosis of that condition. So how a disease condition is going to affect a person's life in the long term. That's what a prognosis is. And here they have said negative prognosis. So that means what you guys have told. When something is negative, when the prognosis is negative, that means it's not going to be good. As time passes, the patient's condition is going to get bad. Okay, so that meaning is correct. So here they have given negative prognosis, then they have given life expectancy 4 months. Okay, so should I include that? That is my question.
Yes, ma'am.
Okay, I need to include that. Okay, I'll take it. Okay. Now, can I ask you one thing? Is the life expectancy current life expectancy, or was it her life expectancy in the month of December?
No.
Right now, are we talking about right now her life expectancy is 4 months, or was the life expectancy 4 months in the month of December? Go through it. Come on, tell me.
Past history.
Past. Okay, keep that in mind. The life expectancy is not current life expectancy. This was past. This is a past one in December, in the month of December. At that time, her prognosis was found to be negative. Yeah. So this is a life expectancy that they mentioned in the past. Okay. Now, should I say she was depressed and not eating? Well, if you want, you can say it. That's okay. Okay, if you don't say it also, that's fine. Now, what about we offered her palliative chemotherapy, but she refused it? If you want, what about it? Should I include it? Come on, tell me. Yes, you can include that. Okay, we offered her, she refused it. Now, I want you guys to focus here. What about this one? Wished to return to home to family. Should I write this in my letter? Wished, not required. Okay, but you can say returned home, you can say, but you don't need to say wished, because in December she wished and later on she went home. Okay, so you don't need to say wished anymore. You can just say she returned home to family. Okay, all right. And of course, I need to include her current medication, right? Because the reader is going to take care of the patient, so they need to know what medication she's taking right now. So of course, we can include that. Now, look at the social history. What are the things that I can include from here? What about the first point? Should I say her husband is her main caregiver? Then he reduced his working hours for her. Should I include that?
Yes, ma'am.
Okay. And what about the kids?
Not required, ma'am.
Okay. But see, the husband is struggling to take care of the kids. So I need to include the kids because right now husband is struggling because of this point. he is struggling to manage their kids who sometimes misbehave. So when I talk about kids, I need to mention that she has 2 kids who are like very young. Okay, because the husband is struggling to manage that. And what about the third point? Husband reports difficulty in caring for a dying partner. Should I include that?
Yes.
Yes.
Yes, ma'am.
And a husband is under emotional and physical stress. I can include that. Okay. Should I include how their house was? Houses. Does it matter to the reader? Not required. Not required. Very good. Not required. Now, how does husband feel? He feels isolated. I can write that. And they have no other support available. I can write that. Neighbors help with child minding. Should I include that? Does it affect the reader?
No, ma'am.
No. And what about the last 2 points? How does she feel, right? How does the patient feel? She does not like people coming to see her and she has asked for spiritual advice. I can include that. Okay. Now look at the plan. The plan is respite admission for her. Why? So her husband can take a break and I need to include that as well. Okay. So all of you take a second, go through what we have selected. Go through what we have selected. Okay. Go through what we have selected. All of you. We have taken. So look at the dates. Look at the dates. Today is March 6th. Okay. Go through it. Go through it. Go through what we've selected. Okay. Now go through the other things. Okay. Now let's think about the introductory paragraph. Okay. All right. Then we will worry about the organization and sentence structure and everything. Let's start with the introductory paragraph. So always remember, in a good introductory paragraph, of course, you will write the patient's full name. That is there. But more than that, you need to include purpose. You need to include purpose. What do you want from the reader? Along with that, you should also include some latest relevant information on the patient. Sometimes it can be the diagnosis. Sometimes it can be the patient's current problem. Sometimes it can be patient's history. Sometimes it depends on the scenario. You need to include a piece of information that gives the reader some idea about the patient. Okay, and it is up to you as a writer to choose what you want to include in the introductory paragraph. Okay, all right. So tell me one thing. Purpose. What is the purpose for today? What is the purpose? Yes. Respite admission. Respite. Palliative respite admission. So I'll include that. Palliative respite admission. So of course I'll include that. Then what else? Some latest relevant. What information can I include about in the intro itself? What information can I include? What can I include? Diagnosis. Yes, stage 4 ovarian cancer. Yes, stage 4 ovarian cancer. I need to include that. Okay. And okay, what is the complete diagnosis? Stage 4 ovarian cancer and metastasis, right? That entire thing I can include. That's her complete diagnosis. She has stage 4 ovarian cancer with metastasis. Okay. All right. So I'm going to write my intro with these things as as content. So go through it. I'm writing to refer Mrs. They have given Mrs. So I need to use Mrs. I'm not using Mrs. because she's married. I'm using Mrs. because they have specified. Okay. So I'm writing to refer Mrs. Crystal Williams. Crystal Williams. You can say who has stage 4. Don't write in numbers or spell the numbers out. Stage 4 ovarian cancer. Ovarian cancer. Don't say metastasized. You can say with metastasis. With metastasis to her liver and left lung, if I'm not wrong. Liver and left lung. So I mentioned the diagnosis, full stop. Then I can say she will need, whichever that you like. She needs palliative respite admission. If you want, you can write at your facility. That is fine. That's completely okay. Okay. So I'm writing to refer Mrs. Crystal Williams, who has stage 4 ovarian cancer with metastasis. Don't say metastasized. So that is a past when you're writing it as a current diagnosis. So you can say stage 4 ovarian cancer with metastasis to her liver and left lung. This whole thing is the diagnosis. If you don't want to start with I'm writing to, you can start with thank you. You can say thank you for providing palliative respite admission, palliative respite admission for palliative respite at 1 second. Okay, 1 second. Yeah, palliative respite admission for Mrs. Okay, 1 second. Yeah. Right, Mrs. Crystal Williams. Mrs. Crystal Williams, who has stage 4 ovarian cancer with metastasis to liver and left lung. Okay, that's it. Go through it. Come on. All of you. So it's up to you, whichever this one that you can choose. So go through the introductory paragraph. Okay, now let's have a look at the what are the things that you can include next. Okay, so you have talked about the diagnosis, you have talked about the purpose. Now look at the selected details now. So we have social history, then we have this one from the the cancer, the prognosis, the whole thing, then medication. So among these things, what will you place as your second paragraph? Think about the content of the introductory paragraph and tell me what can you place in the second paragraph that will logically blend well with the introductory paragraph. So should I mention current medications, or should I mention the prognosis, chemotherapy, all these details, or should I mention social history? What would blend well with the introductory paragraph in the second paragraph? Well, which one would be appropriate? Smita, Preeta, Jose, can you unmute yourself and tell me what is logically what would make sense?
Prognosis.
Prognosis, yes. So we will talk, 1 second, we will mention, so in the second paragraph, we will mention about what happened after the diagnosis. Okay, so when it comes to that, so we can mention, so in the second paragraph we can mention about second para. So should I repeat the diagnosis? I don't need to repeat the diagnosis. I can mention about the negative prognosis, which is prognosis which is the life expectancy point, life expectancy after, life expectancy of 4 months. Okay, then I can talk about offered chemotherapy and she refused it. Chemotherapy, then she refused it. She refused. Then she returned home to her family. So that brings me to one important point. How do you convey a negative prognosis, which is the life expectancy? Okay, okay, 1 second, to convey life expectancy. So usually what students do is whenever they see negative life expectancy, which is the negative prognosis. So if it was just negative prognosis, you could have written, okay, 1 second. Let me just write it down properly. Okay, so if they have given life expectancy of the patient as a negative prognosis, then how would you frame that in a sentence? Smita, Jose, what would you write? If you're writing that negative prognosis in the sentence, how would you write that? How would you write? What would be your version of that sentence? Yes. Smita, do you want to try? Yes, tell me, how would you write that, Smita? So her negative prognosis in December was the life expectancy. So how will you write that?
Due to?
Give me a sentence. Yes. Due to? Due to what? Due to what? Jose, how would you write? Smita, think about it. Preeta, how would you write? Yes. Come on, tell me. I need an answer. Come on. What would be your version? Okay. All right. Yeah. Tell me, Jose. Yeah.
Her life. Sorry.
Her life expectancy. Okay. Her life expectancy. Yes. Yes, Jose. After that. Okay, all right, okay. Let me see. Okay, so when a prognosis or when the prognosis is negative and that it is mentioned as a part of life expectancy, usually students say her life expectancy was negative prognosis. No, there are three ways that you can write. Okay, one is you can. So first of all, this is a past one, right? Past prognosis, like past. So what do you, that means you cannot use is, are, or anything. You need to use was or were. So you can write one way is you can say her life expectancy was found to be 4 months. Okay, one thing. Or you can say she was only expected to survive. She was only expected to survive for she was expected to survive. 1 second. She was not only here. She was expected to survive only for 4 months. Okay. If you're like, okay, these are the two. The third version, that's this version. You can mention the prognosis. Okay, her not negative prognosis. You can write her prognosis was only 4 months to live. Okay, so if you're bringing prognosis into picture, you need to mention it like this. So you can say her life expectancy was found to be 4 months, or she was expected to survive only for 4 months, or her prognosis was only 4 months to live. All of you go through it. So the current, if right now, if you're talking about life expectancy of at the moment, then you can say the same thing, but you can replace was with is. So her life expectancy is found to be 4 months. Whichever that you like. Second, you can say she is expected to survive only for 4 months. I'm just writing numbers right now. You need to, okay, for 4 months. Okay, all right. Next one, her prognosis becomes is. Her prognosis is only 4 months to live. Okay? All these are fine. So any of these versions which you can easily remember, which you are confident with, you can use. But remember, when you say prognosis, you don't say anywhere, you don't say negative prognosis. When you're mentioning prognosis, and if you want to convey it as a prognosis, this is how you convey. All of you go through this. I'm not talking about mentioning negative prognosis. I'm talking about when they've given life expectancy as the negative prognosis. How do you talk about it? You can focus on life expectancy was found to be how long, or you can mention it like this: the patient was expected to survive for how long, or you can mention her prognosis was only how long to live. Okay, all of you go through it. Come on, all of you. All these three are fine. Okay, so any of these versions which you are comfortable, which you think that matches with your style of writing, which you can easily remember, utilize that. But make sure to notice whether we are talking about a life expectancy in the past or at the moment of writing. If it's right now, then these are okay. If it is in the past, any of these are okay. All right. So Joe, Smita, Preeta, go through it. Come on, understand it and go through it. All of you. All of you, come on, come on. Okay, perfect, perfect. Now let's have a look at so we decided the second paragraph. We will talk about the prognosis. We'll talk about how we offered her chemotherapy and how she was like she did not want it, and she returned home to her family. Now that brings me to our third paragraph. What is that? Now we have written about her problem after the diagnosis. Now what else? What should be the third paragraph? What can I include in my third paragraph? So we have covered these things. Now what can I include in my third paragraph? Come on. What would make logical sense here?
Current medication.
Can I start with current medication? Just think about, look at the paragraph, okay? Look at the paragraph here. You talked about what happened after diagnosis, how we found, what was the life expectancy, how we offered chemotherapy, how she returned to family. Now, can I just talk about current medication?
Social and family, ma'am. Social and family.
It would be better if we talk about the other problems. The problems being husband, other problems. So family issues. So I can talk about. So what other problems she has? Okay, wait for the medication, because if I write medication, it doesn't logically blend well. Okay, so I can talk about what other problems. About what other problems she has. Okay, both her issues, her husband's problems, issues, plus her own issues. Okay, her own. That will make logical sense. Okay, because we are not focusing based on the time here. Rather, we are looking at the thing. We have a lot of problems, so we are arranging them in such a way that it makes logical sense. So we talked about what happened after the diagnosis. Now, in the third paragraph, you can talk about. Sorry, one second. Third paragraph, you can talk about. Third para about her husband's issue. Mike feels. Okay, one second. What did Mike do? Mike, is the main caregiver, is the main carer. He reduced his working hours. Then what else? He is unable. He cannot take care of her. You can mention that. Then what else? He feels isolated. Feels isolated. Then what else? How would and he's under 1 second, angry, isolated, under emotional and physical stress. Yes, emotional and physical stress. Anything else? Any other problem with Mike? What other problem? Are these it? Anything else? Mike is the main carer. He reduced his working hours. He cannot take care of her. He feels angry, isolated, under emotional and physical stress. Go through it. Come on. Any other issue? He finds it. Yes, he's difficulty to manage his kids. He's struggling to manage his kids. Difficulty to manage kids. No other support for them. No other family support. Okay. Okay, that was about Mike, right? We have written everything about the husband. Now about her. What is her problem? She does not like visitors. She requested for spiritual advice. Now, so you can say that in this paragraph, or you can say it in the fourth paragraph. It's up to you. So I'm just adding it here itself. Now, Mrs. Williams does hate visitors. Hate is a strong word. Does not like visitors. Then plus requested spiritual advice. Okay, all right. Now after that, so we have written after the diagnosis how it is. And 1 second, let me just arrange it properly. Yes, yeah. After the diagnosis, how it is, then her husband, what are the problems that the husband has, and how does how does Mrs. Williams feel about everything? So we have written the problems. Now in the fourth paragraph, what can we include? Should I include why do they need the respite admission, or should I talk about current medications? Which would make logical sense?
Current medication.
Current medication, will it blend logically? If I in the fourth paragraph, if I'm like going, okay, these are the problems and her current medications are, would it make sense? Or should I say about why do they need the, especially what is the exact reason for this one, respite? I would say keep this, because current medication is not something that, okay, one second. Okay, so fourth paragraph, I would strongly prefer, mention needs respite admission. Respite admission for what? For what? Okay, because current medication is just a one single sentence. You can logically blend it somewhere else. Okay, so one second. So in the fourth paragraph, I would recommend just say she would need one second. She will need respite admission. Need respite admission. So her husband can take a break. Can take a break. Break and resume his work. Then I would recommend, because current medications are, see, there are four medications. It's just one single sentence, right? Go through it. Stemetil for nausea, Maxilone for nausea, Oxycontin for pain relief, and Panadol for pain. These are the things, okay? So you can just write one single sentence. You can highlight it at the end. You can say, please note, then mention the medication. That would be better, because medications, like, we are not talking about past, then current. No, we are looking at the theme. The first paragraph, after talking about the purpose and some latest relevant information about the diagnosis, some latest relevant information about the patient. Second paragraph, you focused on what happened after the diagnosis. Third paragraph, you mentioned all the other issues. So then you can say, considering all this, she will need respite admission in order to help her husband take a break and resume work. Then at the end, you can highlight the medications, because otherwise the medications will stand as an odd piece of information. It won't logically blend. Okay, so don't be in a rush to mention here, because you will be like, after that, these are the past events, these are the current events. No, that's not how we have organized. We have organized based on the logic. Introductory paragraph, you mentioned the diagnosis. Second paragraph, you focused on after the diagnosis the problems. Then you mentioned about the current problems. So medications is not a problem. It's an additional piece of information. So you can actually mention it before you end the letter using please note. That would be better. Okay, and because we have not organized on the basis of past events, past, current, future. No, we don't have any future events as such. Our organization was, we have a lot of problems and we have arranged it based on the intro. Second paragraph, we focused on the problems that happened after the diagnosis. Third paragraph, we mentioned the other problems. Medications are not a problem. It's a piece of information that the reader needs to know. So once we have written the problems and once we have mentioned why exactly, what is the purpose of the respite admission, then at the end you can highlight the medications. That would be better. But if you want to place the medication before, go ahead, not a problem. You can also say, or you can, okay, I'll write that. I don't disagree with Joe's. It's okay, it's completely fine. Or you can, in the fourth paragraph, you can say additionally, then mention the medication. That's also fine. But logically, what would be better is once you have mentioned all the issues, then mention what is the purpose of the respite admission, because so her husband can take a break. Then at the end, you can also highlight the medication. It's up to you. It's up to you. Okay, so both versions are fine. I wouldn't say just because you wrote medications in the fourth paragraph, you will lose marks. No. Okay, but I wouldn't recommend medications here, because here we are talking about past issues. So second paragraph, basically we are focusing on the issues after the diagnosis. Third paragraph, we are focusing on other problems that the patient has. So that logical flow, I didn't want to break it. That's why I mentioned the medications at the end, because it's not a problem, rather it's an extra piece of information. All of you, Joe, Preeta, Smita, did I convey myself clearly? Did I convey myself clearly on why I placed medications before the ending?
Yes.
Okay, all of you go through it. Come on, go through it. Okay, I'm not saying your version of medications, but I would not recommend keeping medication in the third paragraph. Either keep it in the fourth paragraph by using additionally, or once you have written why you need the respite admission, then you can highlight it using please note. Okay, so but do not mention it in the third paragraph, because the logical flow will break. Okay, so after the first paragraph, second paragraph, we have written the problems after the diagnosis. Third paragraph, we have written other problems. And fourth paragraph, either you can write, use additionally and mention the medications, or you can write the patient needs respite admission so her husband can take a break. It's up to you. It's up to you. If you're writing medications in the fourth paragraph, then in the fifth paragraph, you can mention the purpose of the respite admission. Purpose of the respite admission. Needs respite admission. For what? Or it's up to you if you're or you can mention, please note. It's up to you. Fourth and fifth, it's up to you. Go through it. Come on, go through it. So either in the fourth paragraph, you can mention why, for what does the patient need respite admission for, or you can mention fourth paragraph. Then after mentioning in the fourth paragraph for what does the patient needs the respite admission, then you can use please note to highlight the medications. Or in the fourth paragraph, you can mention the medications first. Then in the fifth paragraph, you can mention for what does the patient need the respite admission. It's up to you. Okay, all of you go through it. Come on, go through it. Go through the intro, second paragraph and third paragraph. All of you, come on. I'll just zoom in so it's visible. Go through it. Go through the introductory paragraph and second paragraph. All of you. Why did I place negative prognosis and everything? Because in the intro, I talked about the diagnosis. Now I'm mentioning what happened after the diagnosis. Okay, now go through the third paragraph. So I mentioned the problems after the diagnosis. Now I'm focusing on the current problems related to her husband and related to the patient. Then now focus on the fourth and fifth. Either in the fourth, you can mention for what does the patient need the respite admission for her husband to take a break. Or you can use the connector additionally and mention the medications. It's up to you. So if you're mentioning about respite admission, the purpose for respite admission in the fourth paragraph, then you can use please note in the fifth and mention the current medications. But in the fourth paragraph, if you're mentioning the medication, then in the fifth paragraph, you can mention the need for the for what does the patient need the respite admission for. Okay, it's interchangeable. It's up to you. All of you go through it. Come on, come on. Some people don't like using please note, so that's completely fine. So what you can do is fourth paragraph mention additionally she's taking all these medications. Then she considering all this, she will need respite admission so her husband can take a break and resume work. Or you can do the other way, considering all these things, after mentioning all the issues, considering all these things, she will need respite admission so her husband can take a break. Please note, then you can mention the medications. It's up to you. Okay. Also, go through how we can mention life expectancy, which comes as a negative prognosis. All of you. Jose, Smita, Preeta, go through it. Come on. We are going to look at the sample letter in a second, so go through it. It's not compulsory that you use please note. It's up to you. It's up to you. If you like using please note, go for it. Otherwise, don't worry. I have given you the other option as well. But it's always better so randomly mentioning current medications, because see, in the second paragraph we are talking about the issues, and third paragraph you're focusing on the problems. So in between here, if you mention current medication, it will be an odd, when it comes to the logic behind it, that would stand out. So that's why I told you don't mention current medications in between these problems. So, so basically our structure is introductory paragraph, after the diagnosis, the problems, the third paragraph, the other problems. So don't break this logic here. Okay, with current medications in between, don't do that. Okay. All right. So let's have a look at the sample letter. All of you, let's have a quick look at the sample letter. Then we'll look at each paragraph. As you can see, I've written my address. Since I don't know the reader's name, I said Dear Director. If you don't like Dear Director, you can also use Dear Sir or Madam. You can, when you don't know the reader's name, you can use dear, then designation, or you can use dear sir or madam. We don't know the gender, so mention sir or madam both. Okay. I've used Mrs. because they've used Mrs. You look at the layout. Okay. Now quickly go through the paragraph. Okay, and I've used yours faithfully because I don't know the reader's name. I did not use because, I mean, yours sincerely. I use yours faithfully because I don't know the reader's name. Okay, now let's analyze each paragraph starting with the first one. Okay, so Smita, can you read the first paragraph for me, please?
Yes, ma'am. I am writing to refer Mrs. Crystal Williams, who has been diagnosed with stage 4 ovarian cancer with metastasis to her liver and her left lung. She will need palliative respite admission.
Okay, so I've used purpose and latest relevant information on the patient on the patient. Okay, so I've used I'm writing to refer. Okay, Mrs. Crystal Williams, who has been diagnosed. Why did I use who has been diagnosed? Because I mentioned the diagnosis as an unresolved diagnosis. Okay, I mentioned it as an unresolved diagnosis. So that's why I use has been diagnosed. So when you have diagnosis and right now the diagnosis is not has not been managed, it's not resolved, then you can consider it as an unresolved diagnosis. Okay, so that's why I used it as has been diagnosed with. If you don't want to mention it as a unresolved diagnosis, if you want to mention it as a current diagnosis, that is also fine. That's your decision. Earlier when we discussed, I mentioned it as a current diagnosis. In the sample letter, I mentioned it as an unresolved diagnosis. It's up to me. It's my decision. So I can mention it as, if I'm mentioning it as a current diagnosis, I can say who has stage 4 ovarian cancer. Okay, both are not wrong. Okay, it's up to you. It's your decision. Okay, here I mentioned it as an unresolved diagnosis. That's why I use has been diagnosed with. Okay, when you mention unresolved, when your diagnosis is unresolved, if that's what you want to convey, then you can use has been diagnosed with. And you're like, ma'am, it's too confusing. I don't want to use it. I want to say right now the patient has this problem. Then you can convey it as a current diagnosis using who has what. Okay, then she will need palliative respite admission. So you don't like, I used will need. Okay, instead of will need. Okay, I used will need. If you don't like will need, you can use she needs. You can use she needs what? She needs or she requires. Requires what? That is also fine. Okay, Preeta, Jose, Smita, are you clear with the introductory paragraph? Just go through it.
Yes, ma'am, clear, ma'am.
Okay, now look at the second paragraph. Okay, Jose, can you read the second paragraph for me?
Yes. After her diagnosis.
Yes, after her diagnosis in December, her prognosis was only 4 months to live. So, the focus of my second. Yeah. Okay, continue reading. Continue reading. Jose, can you read? Your voice is breaking. That's why I'm interfering in between. Is it okay? Can you read now? Okay, that's completely fine, Jose. Let me read it. Okay, so after her diagnosis in December. Okay, so you instead of after her diagnosis, you can say following her diagnosis. Following her diagnosis, it's up to you. In December, her prognosis was only 4 months to live. Okay, see how I've conveyed the prognosis, how I've talked about the life expectancy. Her prognosis was only 4 months to live. She was then the next one, she was offered palliative chemotherapy to shrink the tumors and slow their growth. However, Mrs. Williams refused it. Refused what? Refused the chemotherapy and returned home to. So see, they have returned home to her family. And I've actually introduced her family like this. Instead of writing later, her husband's name is Sohadi. She has 2 kids. I've introduced them as her family. So instead of writing family, instead of saying returned home to family, returned home to her family, what did I do? I introduced her family, returned home to, I introduced her family here. Returned home to, who are there in her family? Her husband, Mr. Mike Williams, and 2 kids aged 10 and 12. All of you go through it, come on. And you can talk about prognosis. Her life expectancy was found to be. Okay, don't want to use prognosis. You're like, ma'am, I don't want to do that. I don't like that style. You can say her life expectancy was found to be 4 months. Or you can say she was she was expected to survive. She was expected to survive only for 4 months. It's up to you. I just like this one. That's why I use that sentence. Okay, instead of like that, you can use that. Okay, so all of you go through it. So in the second paragraph, I mentioned about the issues after her diagnosis. How after her diagnosis in December, what was her prognosis, and how that we offered her the treatment, she refused it and returned home to her family. So instead of saying her family, I mentioned who all are in the family. Home to her husband, Mr. Mike Williams, and 2 kids aged 10 and 12. Okay? All of you go through it, come on. Okay, now let's have a look at the third paragraph. Okay, third paragraph, I talked about current issues. Current issues related to her husband, related to her, or I'll just say other issues related to her husband, related to her husband, the patient, related to the patient. Okay. Okay. Smita, can you read the first sentence?
Yes, ma'am. Mr. Williams, who is her main caregiver, reduced his working hours to take care of Mrs. Williams. Yet, now reports difficulty caring for a dying partner. He finds it difficult to manage their kids who misbehave at times. They have no other family support available. He is under emotional and physical stress. Owing to this, he also feels isolated and angry.
Let me stop you there. 1 second, Smita. So I started with the husband's problem. I said that Mr. Williams, who is her main caregiver? So he is her main caregiver. What did he do? He reduced his working hours to take care of his wife. So he did that. Yet, so even though he did that, yet, instead of yet, you can use however, in spite of, despite. So instead of yet, yet, you don't like yet, you can use however, or but, or despite that, he now reports difficulty caring for a partner. So remember, when you say difficulty, if after difficulty you write don't say difficulty in. Nowadays we don't say difficulty in caring for a partner. We'll say difficulty plus ing. That's more than enough. Okay, difficulty caring for a partner. Okay, so difficulty in caring, that's just two. Nowadays we don't say that. It's not actually, I don't think it's technically wrong. Grammatically, it used to be difficulty in caring for a partner. We used to write like that, but nowadays nobody says that. We always say difficulty caring for a partner. Or you can say he has trouble caring for a dying partner. Caring for a dying partner. You don't want to use difficulty because ma'am, next sentence also I'm talking about a difficulty. So instead of difficulty, you can say trouble, caring for a dying partner, or you can say he struggles to care for it. Now he reports struggles to care for a dying partner. Okay, it's up to you. Okay, all right. Then the next one, he finds. So I already wrote he now reports difficulty. Now I use he finds it difficult. He finds it difficult to manage their kids. So he's struggling. Then instead of finds it difficult, I can say he is struggling to manage his kids. That is also fine. Struggling to manage his kids. I need your full attention. Go through it. Come on. And how are the kids who misbehave at times? They are misbehaving. So instead of saying who, don't say because they misbehave. No, he's not finding it difficult to. They have. It's not the reason. Don't say it as that. That is very judgmental, and you are showing the kids in a bad light. So you can say he finds it difficult to manage their kids. So he, not his kids, their kids. Okay, that would be better. He finds it difficult to manage their kids or children who misbehave at times or who misbehave sometimes. Okay, then they have nobody else. They have no other family support available. Or I can say they do not have any other help. They do not have, or they, if you don't write, they do not have, okay, they do not have, or they have no other, nobody else, nobody else to help. They don't have anybody. They do not have anyone else to help, anyone else to provide support. If you want to be a bit elaborate, you can say that they do not have anyone else to provide support, or they have no other help. They have nobody else to help. They have no other help. No other help available. If you want to write like that, that's also fine. Nobody have no other help. No, that does not sound. No, they have nobody else. That could be better. They have nobody else to support them. That is also fine. In whichever sentence that you feel okay, you can write that. Then I've said he's under emotional and physical stress owing to these, or I can say as a result of these, because of all these things, or I can say due to these. He feels, how does he feel? He feels isolated and angry. He's struggling a lot. He's not able to help his wife. He's not able to take care of a dying partner. He's finding it difficult to manage his kids. They do not have anybody else to help them. He's under a lot of stress. And as a result of these, or as a result of these, or I can say due to these, he feels, how does Mr. Williams feel? He feels isolated and angry. Instead of isolated, if you want to say he feels alone and angry, of course, go for it. Okay. Now, I've talked about the husband, then I'm like about the patient. Additionally, can you read the last sentence, Mita? This one? Yeah.
Yes, ma'am. Additionally, Mrs. Williams does not like people coming to see her, and she has requested for spiritual advice.
Okay. So additionally, she does not like people coming to see her, or I can say does not like visitors. That is also fine. It will be much more concise, and she has requested for spiritual advice. All of you go through the paragraph. There were many problems related to the husband. So first I talked about the husband's issues. Then I'm like, additionally, the wife does not like, the patient does not like visitors, and she has requested for what? Okay, she has requested, present perfect, because we don't know when exactly she requested, but we know she has made this request. Okay. All right, go through it. Come on. All the problems. Okay. Now, fourth paragraph. So here in the fourth paragraph, I mentioned for what does the patient need respite admission. So there is a specific reason or a specific purpose for her needing respite admission. What is that? Okay, all of you look at the fourth paragraph. In light of the above, instead of in light of the above, you can say considering the above, or whichever that you like, considering the above, or you can say pertaining the above, in view of the above, whichever you like. In view, so taking all these into consideration, whatever we have said so far, taking that into consideration, it would be appreciated if you could provide admission for Mrs. Williams in order to. Why did I use in order to? See, in the if you see here, they have used so that Mr. Williams can have a break. Okay, but here I used in order to, or you can use for, in order to help her husband take a break and resume work, or you can say for helping her husband, admission for Mrs. Williams for helping her husband take a break and resume work. Okay, so because do not use so in OET letters. OET has suggested that we don't use the connector or the conjunction so in OET letters. Okay, so that's why I use in order to, or you can say for in order to help, or for helping her husband take a break. Okay, you can use that. Or if you don't want to use in order to, you can just say to, or to help her husband. For Mrs. Williams, to help her husband take a break. To help her husband, you can say that. Or for helping her husband take a break. All of you go through it, come on. It would be appreciated if you could provide, or you can say please provide. You can say please provide. Please provide, or kindly provide. In view of the above, kindly provide admission for Mrs. Williams in order to help her husband, or to help her husband, or for helping her husband take a break and resume his work, because the OET has suggested that we don't use so in OET letters. Okay, so that's why I've used, instead of so that, or so, I've used in order to help her, or for helping her, or to help her. It's up to you. Okay, now all of you read the okay, take a second, go through the fourth paragraph. Okay, now look at the fifth paragraph. I've highlighted current medications. Okay, current medications. So there is, logically I cannot place this before, so that's why at the end I highlighted it. Please note. So see here, if you look here, I want all of you to pay close attention here. So Stemetil is for nausea. What else is for nausea? Maxolin is also for nausea. So I wrote both of these together. Okay, both of these together. And as you can see, Panadol is for pain and Oxycontin is also for pain. I wrote both of them together. So nausea medication together, pain medications together. So as you can see, please note she is on, or I can say she is currently taking. It's up to me. Whichever structure that I want to write, I can write. She's currently taking Stemetil 2 times daily and Maxolon for nausea. So 2 medications for nausea, along with, instead of repeating and again, so this is a pair for nausea. I have written along with the Oxycontin 60 mg 2 times a day, and Panadol 2 tablets every 4 hours as needed for pain relief. So 2 medications for nausea. So they are a pair. Now then, so I can so already in a pair I have 1 and 2. Then I cannot say and 3 and 4. So instead I use 1 and 2 for nausea, along with 3 and 4 for this one, pain. Then 2 medications for pain relief. So this is how I've listed the medications. All of you go through it, come on. Please note, instead of please note, you can use it is important to note, kindly note, anything is fine. Adding these extra details here, it's up to you what you want to write, which suits your style of writing. It's important to use. Or you're like, ma'am, I don't want to use, it is important to note. I just don't want to use that. I don't like using it. I want to, write it in some other way. So you can write it some other way. You can also use other than these. Okay. Additionally, I've already used, that's why I use other than these. She is currently taking 1 and 2 for nausea, along with 3 and 4 for pain relief. Okay, I used here because I'm connecting two pairs. So see, 1 and 2 for nausea. Then along with 3 and 4. When you're connecting two pairs, 3 and 4 for pain relief. Okay, all right. If I'd written and here, it would be too much. Never ever write also. When you're listing, it's either and or along with. Okay, so do not use also here. You have used, I don't want to repeat and, so I use along with to connect two pairs. Okay, all right. So all of you take a second, go through it. Very good letter. This is a very good letter. Palliative care, hospice care are common topics that you get for writing. So go through it. Okay. Right. So take a second, go through the letter, sample letter once again and ask me if you have any questions. All of you, come on. All of you, come on. Go through the body paragraphs. Okay, Manju, are you asking for the last paragraph? Yeah, I'll show it. See here. I believe you're asking for the last paragraph in the chat. So this is the last paragraph. Go through it. Okay, all right. So don't worry, whatever you see on the screen, I'll be sending it in the group, sending that in the group. Okay, all right. So all of you go through it once again, the whole letter once again. And remember, I used Mrs. because they had specified it many times, Mrs. I did not use Mrs. because the patient was married. No, that was not the reason. You don't use Miss or Mrs. on the basis of marital status. You use Mrs. only when that is specifically given in your case note. Okay, all right. So that's what that is. I need to tell you something. So this palliative respite admission, I want you to compare this with Anthony Nutt's case note. Okay, so they do have some similarities, and we have taken information. We have not told how the diagnosis was made. We have not told, the patient underwent laparoscopy, then she was diagnosed. No. Why? Because that is not necessary anymore. Okay, so please compare it with Anthony Nutt and go through this case note and the sample letter and the organization. Remember, as usual, we read the first paragraph, then we read the writing task. So when we read the first paragraph, we identified our role as a writer. Then we read the writing task and identified the purpose, whether they have given the type, who is the reader. Then we read the case note. Once we have read the case note, only then we went and selected information. And we selected relevant in details. At the same time, we rejected irrelevant details. Then we wrote the intro. Then we worried about the organization. Always write the intro, then the organization. So that way you will be able to logically connect your paragraphs. Okay, so read the first para, writing task, then read the entire case note, then select the details, of course, selection and rejection, then write the introductory paragraph, the whole layout and the introductory paragraph, then look at the selected details and think, okay, what should I place in my second paragraph? That should be your thought process. That way you will be able to organize your letters more logically. Okay, and again today I did not, even though many of you suggested place the current medications as the third paragraph, I did not place it because I'm talking about issues after the diagnosis. Then suddenly if I talk about medication, which is not an issue, it will break the logical flow. So that's why I wrote the introductory paragraph where I mentioned the diagnosis. In the second paragraph, I mentioned the problems after the diagnosis or things that happened that were of concern after the diagnosis. Then I mentioned other issues. After that, I mentioned the medication. So I did not break the logical flow there. Okay, so please go through everything that we have done today when I send the notes, and please compare these notes with Anthony Nutt. Okay, it's extremely important. Make sure to compare. So hospice care and palliative care or palliative respite admission are kind of a common topic in OET writing. If you get that, you will be able to write these letters very well. And I think similar one had come for the exam last year as well. So please go through it. And if you have any questions, get back to me. Okay, so Smita, yes, ma'am. Yes.
Can you just show me the question, ma'am? I joined late, ma'am. So sorry,
the question, Manju, are you there in the group?
No, ma'am.
Okay, don't worry. I think this will be uploaded in YouTube as well. Okay, so the whole
Okay.
thing, the whole case note, everything will be uploaded in YouTube. So you can go through it because it's a, I have, scribbled all over the case note.
No issue, ma'am. I will just read it and just I will take screenshot, ma'am.
Okay, all right, go for it. But one second. Okay, so please compare it with Anthony Nut case note. Okay, and if you have any questions, ask me. So in YouTube we have already uploaded Anthony Nut. So go through it and compare it with this one. This one I think next week they will upload this one. Not this week. Next week they will upload this one. So that time you can go through everything. Okay.
Sure,
Yeah.
ma'am.
Okay. Next page as well. Okay. So and if all of you, if you have any questions, feel free to get back to me. Okay, all right. So that's it for now. I'll see you guys on Monday. Okay, so that's it for this week. Okay, next session.
Thank you, ma'am.
All right. Thank you, everyone. Thank you.